So we are planning for full arch rehabilitation of this patient. As such, this is a very straightforward situation, lots and lots of bone. The sinus is too far away from the lateral nasal wall and away from the root apex of the natural tooth also. So the challenge comes when the sinus moves in two directions, more anterior, more downward, and it complicates pterygoid implant placement when the sinus progresses distally towards the tuberosity. So we will plan for a first all on 4 style, then we will decide whether additional molar implant is needed. So we will start the implant from the second premolar, which is a standard one. Sometimes we can start from first molar also. Okay, but the difficulty is in the access implant placement. That is one challenge, but there is good bone here. We can tilt the implant from first molar also, but we have to check the smile of the patient. If the patient is having any gummy smile, then we may need to give 6. Already the patient was having 7. So here also the patient was having 7. So it is better to give 7. So patient will be accustomed to bite in the till the 7 region. So we will plan for a 6 implant. So we will start from the second premolar, so that we will place one implant in the 7 area. So we will start from the second premolar. Sorry. And we can tilt not only mesially but on the bucco-palatal plane also. If we tilt too palatally, the length is around 16 mm, but if we tilt along the buccal wall, the length is around 18 mm. So this difference we have to understand. Going along the buccal wall, it will help to achieve a better multi-unit abutment position. We can see the buttress here. This is the nasomaxillary buttress here. Usually the buttress will be present from the canine area, but here it is available in the premolar area also. So it is a wide buttress. We can appreciate here also, from here to higher, from this area is the buttress region. So the width of the buttress and the bucco-palatal width and mesiodistal matters. Here this patient has got a good width in both directions. So right tilted is over. It's a straightforward situation. Left tilted, we will start from the second premolar and tilt it mesially, and we will stay along the buccal wall. So if you see here, there is one interesting thing is that if you drill, you may not feel any dip. One time one doctor asked this doubt. So sometimes when I am drilling in the premolar area, I am not feeling any dip, it is going straight. So the reason is because of this nasomaxillary buttress, which is very wide, not only mesiodistally but also bucco-palatally. So these are the lucky situations. Okay. So if you tilt palatally, your length will be around 15 or 16. It's almost 14. Okay. But if you stay along the buccal wall, you may achieve more than 23. Even it goes beyond 30. Okay, which is usually rare. Okay. So we need a 16 to 18 mm implant, that is more than enough. Okay, if you come in this direction, you will get the dip, but if you go in this direction, knowingly and unknowingly, you may not get the dip. So that is the reason for not getting the drop or dip. So here also the same thing will happen, right side also. If you go in this direction, you may go longer. Okay. So the distal tilted implant or the key implant to take care of the compressive load. Now we are coming to the axial implants, which take care of the tensile load. Anteriorly stay as close to the possible to the palatal wall, because the more you come labially, this thin labial wall will crack. So stay close to the palatal wall. immediately distal to the nasopalatine canal. Okay. So here there is a central incisor. So one option is to place the implant into the socket, that is one option. It is a preference, but we usually start in the interdental bone between 1-1 and 1-2. Okay, because placing implant into the 1-1 many times it encroaches the nasopalatine canal, and we tend to place two implants very close to each other. If you place two implants in the central incisor, the two implants are very close to each other. When the two implants are too close to each other, functionally they are not, it is not advantageous. It is equal to placing only one implant rather than placing two implants close to each other. It is better to place only one implant here, because the biomechanics works in such a way. So if you give a little distance between these two implants, it is beneficial for force distribution. Okay, so don't place two implants too closely, it is not giving any advantages. Okay, so here this interdental bone and the bone between the palatal wall and the these roots is the area where we are going to place the implant. You can see there is no interdental bone between the central and lateral layer. These are all the challenging cases. This interdental bone will come out, thin bone. So if you see the right side, there is enough island of bone palatally, but here there is very less island of bone palatally. So these are the challenging situation to place axial implant on this side. So in those kind of situations, we can start from the island from lateral and canine area. So that is also one option is there. So two axial implants, we will place a minimum diameter implant to prevent labial bone cracking, and we will get engagement from the nasal floor. It will give some stability. The bone is quite osteoporotic. Okay, on left side but not on right side. So now we are planning for the 7 support. Either we can go for a classic pterygoid, okay, which is not necessary because there is a lot of bone and too much bone is available in the 7 and 6 area. But we are planning to give 7, so it is better to place one implant in the 7 area. So this is the is interesting anatomy here. The sinus is very far away, and not only that, between the medial wall of the sinus and the lateral wall of the nose, there is an island of bone which is called the palatal bone, which is a very good implant, a very good bone. We can place implant into this palatal crest. If we drill here, we may not get a good stability, good length, 13 mm only, but if you just tilt here and aim the this crest between the sinus and the nasal cavity, this we can only appreciate in CBCTs, so better to take CBCTs always. So if we plan for a straight implant, we are not getting good bone, but if we tilt mildly distally, we are getting good bone. So this is more than enough. We will plan for the left side. Okay, so left side luckily multi-rooted tooth, right side is a conical root. Whenever conical rooted molar is there, the implant placement is challenging. Here the palatal root is there, multi-root. So when the palatal root is there, it is a good scenario because the palatal socket itself is a cortical bone, and we are aiming towards that palatal bone. Easily we are getting 18-20 mm. Okay, so pterygoid is not needed. Even 6 implant is not needed for this patient, but patient was habituated with 7, so he may feel a decrease in efficiency after implant treatment, so better to give 7 also.